Hey everyone, Dr. Mike here. Today we're talking about colon cancer, the silent killer. It often develops with no symptoms, making early detection critical. These aren't just numbers, they're our loved ones. Listen to your body. Don't ignore subtle signs and talk to your doctor. Your health is your greatest asset. Let's dive into the early warning signs. Changes in your bowel habits can be an early sign of colon cancer. If you notice a lasting shift in your usual pattern, going more or less often, feeling urgency, or not feeling fully emptied, don't ignore it. If these changes persist for more than a week or two, talk to your doctor. Awareness is your first line of defense. Occasional changes in bowel habits are normal. Stress, diet, or illness can cause short-term shifts. But if you notice a persistent change lasting more than a couple of weeks, it could signal something serious, like a tumor. Don't ignore ongoing symptoms. Establish your normal, and if things don't return to baseline, make an appointment with your doctor to get checked out. Now let's zoom in on a specific type of bowel habit change: persistent diarrhea. Everyone experiences diarrhea from time to time. It's an unpleasant but common reaction to things like food poisoning, a stomach virus, or even certain medications. Typically, this kind of acute diarrhea runs its course in a day or two, and then things go back to normal. However, when we talk about diarrhea as a potential symptom of colon cancer, we are referring to something very different. We're talking about chronic or persistent diarrhea that lasts for more than a week, or that comes and goes frequently over a longer period. This isn't just about having loose, watery stools. It's about a pattern that doesn't have an obvious cause. You haven't traveled to a new country, you haven't eaten anything suspicious, and you don't feel sick in the way you would with a stomach flu. Yet, the diarrhea continues. In the context of colon cancer, this can happen for a couple of reasons. A tumor can secrete substances that cause the colon to expel excess fluid, leading to watery stools. Alternatively, a large tumor can create a partial blockage, allowing only liquid stool to squeeze past the obstruction, which presents as diarrhea. It's also crucial to pay attention to the accompanying symptoms. Is this persistent diarrhea happening alongside other signs we've mentioned, like abdominal cramping, bloating, or that feeling of incomplete evacuation? The combination of symptoms can paint a clearer picture for your doctor. For example, experiencing chronic diarrhea alternating with bouts of constipation can be a particularly telling sign. This pattern may indicate that a tumor is intermittently blocking the colon, causing a backup, constipation, which is then followed by the passage of liquid stool or diarrhea that manages to get around the blockage. The key here, once again, is the duration and lack of a clear trigger. It's easy to fall into the trap of self-diagnosing and assuming it must be a food intolerance you've suddenly developed or just a sensitive stomach. But chronic diarrhea is your body actively telling you that there is significant ongoing inflammation or a mechanical issue within your colon. It's a symptom that demands investigation, especially if it's a new problem for you. Don't let weeks turn into months. If diarrhea is your new normal, it's time to find out why. One of the most deceptive things about diarrhea as a cancer symptom is how easily it can be mistaken for less serious conditions. Many people with these symptoms might initially think they have developed irritable bowel syndrome, or IBS. And it's true, the symptoms can overlap significantly. Both can cause chronic diarrhea, cramping, and bloating. However, a new onset of IBS-like symptoms, especially later in life, over age 40 or 50, without any prior history, should be evaluated carefully by a physician to rule out more serious causes like colon cancer before an IBS diagnosis is made. Furthermore, the nature of the diarrhea itself can be misleading. People often expect cancer to cause a blockage and constipation, so the presence of loose stools can feel counterintuitive. This leads many to dismiss the possibility of something serious. They might think, well, at least things are moving, so it can't be a blockage. But as we discussed, this is a fundamental misunderstanding of the pathophysiology. A tumor can absolutely cause diarrhea by either irritating the bowel lining or by creating a partial obstruction that only liquid can pass. Another reason this symptom gets ignored is the temptation to self-treat. When faced with persistent diarrhea, the first instinct for many is to reach for over-the-counter anti-diarrheal medications. While these can provide temporary relief of the symptom, they do absolutely nothing to address the underlying cause. If the cause is a tumor, using these medications can mask the problem and delay a proper diagnosis. This delay is critical time that could be spent starting effective treatment. This is why it's so important to seek a diagnosis before starting long-term treatment for any new symptom. Ultimately, persistent diarrhea is a significant deviation from normal bowel function. It can lead to dehydration, nutrient malabsorption, and a decreased quality of life, regardless of the cause. But when it stands as a potential flag for colon cancer, its importance is magnified tenfold. If you have been experiencing diarrhea that lasts longer than a week or that recurs frequently, especially if it's accompanied by any other symptoms we discuss in this video, please make that call to your doctor. It is always better to check and find out it's nothing serious than to wait and wish you had acted sooner. Constipation happens to everyone sometimes, but persistent ongoing constipation is different. If your usual remedies, like more water, fiber, or laxatives, aren't helping, it could be a sign of a mechanical blockage, like a tumor in the colon. This isn't just an inconvenience, it's a red flag. If you notice new, stubborn constipation, especially if you're over 40, talk to your doctor to rule out a serious cause. Ongoing constipation isn't just about difficulty passing stool. Watch for subtle clues like pencil-thin stools, persistent abdominal pain, or a constant sense of fullness. These can signal a blockage in your colon, especially if constipation doesn't improve with lifestyle changes. Don't ignore these signs. Listen to your body and talk to a healthcare professional if you notice these changes. Blood in your stool is never normal, don't ignore it. Bright red blood usually means bleeding from the lower GI tract, like the rectum or sigmoid colon, and can be caused by hemorrhoids or something more serious like cancer. Black tarry stool called melena suggests bleeding higher up, such as in the stomach or small intestine. No matter the color, see a doctor right away. Not all bleeding from colon cancer is visible. This hidden or occult bleeding can slowly drain your body's iron, causing fatigue and anemia, often before you notice any blood at all. That's why screening is so important. Tests like the FIT can detect hidden blood early when cancer is most treatable. If you see any blood, get it checked. Don't wait. Early detection saves lives. Rectal bleeding is common, but it's not always just hemorrhoids. Both hemorrhoids and rectal cancer can cause bright red blood, and you can't tell the difference just by looking. Even if you have a history of hemorrhoids, new or persistent bleeding should always be checked by a doctor. Don't assume. Get evaluated to rule out something serious. If you notice rectal bleeding, don't ignore it. Your doctor will ask about your symptoms and medical history, but a physical exam, especially a digital rectal exam, is crucial. It's quick, simple, and can detect issues like hemorrhoids or even rectal cancer early. Don't let fear or embarrassment stop you from getting checked. Early detection saves lives. Unexplained bloating or abdominal pain is common, but persistent discomfort is a red flag. We're not talking about the occasional ache after a big meal, but a nagging pain or bloating that just won't go away. Think of your abdomen like a busy city. If there's a roadblock like a tumor or polyp, it can cause a major traffic jam. This can trap gas and stool, leading to that uncomfortable, bloated sensation. If this is new, persistent, and not linked to food or activity, don't ignore it. See your doctor. Unexplained bloating or abdominal pain can be easy to ignore, but it may signal something serious. Colon tumors can cause mild, persistent discomfort, sometimes just like indigestion or a pulled muscle. Don't wait for pain to become severe. If you notice new, ongoing pain, especially with other symptoms like bloating or blood, talk to your doctor. Early detection is key. Trust your gut and seek help. Feeling constantly tired isn't just about needing more sleep. This deep, unrelenting fatigue can be a hidden sign of iron deficiency anemia, often caused by slow, chronic blood loss from colon cancer. When your body can't make enough healthy red blood cells, your organs and muscles are starved of oxygen, leaving you weak and drained. If you're always exhausted despite rest, don't ignore it. Your body may be warning you of something serious. Feeling tired all the time can creep up slowly, making it easy to dismiss. But persistent, unexplained fatigue, especially if you're needing naps, struggling to concentrate, or cutting back on activities, can be a red flag for anemia from internal bleeding. A simple blood test can detect anemia. If rest doesn't help, talk to your doctor and ask for a blood test. Don't ignore your body's signals. Sudden or unexplained weight loss is a major alarm bell for doctors. While losing weight without trying might sound appealing, it can signal something serious happening inside your body. If you're losing more than 5% of your body weight in 6 to 12 months without trying, pay attention. This isn't just fat loss, it can be muscle too, and may be linked to serious conditions like cancer. If you notice this, talk to your doctor right away. Sudden, unexplained weight loss can be a sign of cancer's metabolic hijacking, known as cancer cachexia. The tumor acts like a parasite, redirecting nutrients away from your healthy tissues and muscles, causing visible wasting and profound weakness. This isn't just a number on a scale, it's evidence of a serious internal struggle. If you notice this, don't ignore it. Make an appointment with your healthcare provider. Early action is crucial for your health. Feeling full all the time or early satiety means getting full quickly or after just a few bites. Many dismiss it as stress or aging, but if it's persistent, it could signal something pressing on your digestive system, like a tumor in the colon. If you're losing interest in food or can't finish meals you once enjoyed, especially with unexplained weight loss, talk to your doctor. Don't ignore this subtle but important symptom. Feeling full all the time is your gut's way of sending an SOS. It can signal a physical or chemical problem, sometimes linked to serious conditions like cancer. Pay attention to persistent changes in your appetite, not just one off day. Track your symptoms and talk to your doctor. Listen to your gut, it could be telling you something important. And that wraps up our list of 9 colon cancer symptoms you should never, ever ignore. We've covered a lot of ground, from changes in your bowel habits to more systemic signs like fatigue and unexplained weight loss. My goal here isn't to scare you, but to empower you with knowledge. Awareness is your single greatest tool in preventative health. Understanding these potential warning signs allows you to be a proactive advocate for your own well-being. Recognizing a symptom early and seeking medical advice promptly can make all the difference in the world when it comes to diagnosis, treatment options, and overall outcomes. Thank you so much for watching and for investing this time in your health education. If you found this information valuable or think it could help someone you know, please give this video a thumbs up and share it. Spreading awareness can genuinely save lives, and your share could be the nudge that encourages someone to see their doctor about a symptom they've been ignoring. Every share, every conversation helps to demystify these topics and encourages open dialogue about our health, which is something we desperately need more of. Remember, knowledge is power, especially when it comes to your health. And of course, if you want to continue learning about your body and how to take the best possible care of it with science-backed, no-nonsense health content, make sure you hit that subscribe button and turn on notifications. We have so much more to talk about, from debunking medical myths to deep dives on other important health conditions. My mission is to give you the information you need to live a healthier, happier, and longer life. And I'd love for you to be a part of this community. Your engagement helps us continue to create content that matters. Finally, I want to leave you with this thought. Your body is constantly communicating with you through signs and symptoms. It's a continuous dialogue. It's up to you to be an active participant in that conversation. Don't dismiss the whispers before they become screams. Pay attention to changes, trust your instincts, and never hesitate to seek professional medical advice. Take care of yourself and stay healthy. Your body is talking. Make sure you're listening. As always, stay happy and healthy.